Where do you turn if a child or a teenager in your care needs psychological support? Are the structures in place to deal sensitively with a young person who may be battling depression or anxiety or even something more serious on a mental health level? Dr. Stella Mokitimi is a PhD graduate from the University of Cape Town. She's written her thesis on this very issue, focusing on mental health services for teens and children in the Western Cape, and she joins me now. Dr. Mokitimi, congratulations and thank you very much for joining me. So you've looked at the Western Cape as an example. Looking at the health services for children, because as we know, children have very specific needs. They're still growing, they're still developing. If I had to ask you what the main points of your thesis discovered, the things that we most urgently need to look at when it comes to helping our youngsters through psychological distress, what would you say we need to take cognizance of most urgently?
Most urgently, I could say from my findings, number one, leadership and governance for child and adolescent mental health services, financing, policy development, and provision of resources specifically for children and adolescents that are separate, completely separate from adults.
How does it add to a child's trauma or a teen's trauma if they are put into a facility with adults? Doctor, can you still hear me?
Basically, when we put a child who's got a mental health problem already, put a child who already has a mental health problem in an environment where there is a mentally disturbed adult, that is basically re-traumatizing the child. For an example, the child will get exposed to the inappropriate psychotic behavior of the adults. Children who have been in the same environment with the adults have reported feeling traumatized. It raises fears for the child of being, what am I going to be? Am I going to be like this when I grow up, when I'm an adult? Am I going to end up like this adult that I see in front of me? And again, it creates problems with compliance, to the treatment, because you may not find the child coming at your door again for a service because of what the child sees and what the child fears to be. Yes.
So can I just ask you, let's say a child of 12 has a psychotic break and they have to go into a facility. Would they be housed in the same facility as adults with the same sorts of problems?
A child from up until the age of 12, you will find that child with a psychiatric problem in a pediatric environment, which again, it is not ideal because it means that you will admit that child in a medical environment that is not necessarily ideal, and with a non-specialist, and you're exposing possibly that child to other contagious diseases in that environment. From the age of 13 onwards, you will find that child in an adult psychiatric emergency unit, which is also ideal because then it creates that exposure that is so inappropriate for the child, and the environment is not at all child-friendly.
Wow, I can just, a child of 13 in an adult facility, it is worrying. I want to look at, and this is something we're just seeing so much at the moment, that children are becoming more anxious, more depressed. There's more reports of suicidal thoughts amongst teens. If we look at the chain of support, right from the parent or the caregiver to the mental health professional, perhaps even to a facility, what are the weak points that you've identified and what's actually working along that chain?
While I have not specifically looked at the chain, but what happens is parent is welcomed to approach the mental health nurse or the nearest primary healthcare facility in pediatrics, or even at the mental health nurse services, where the parent will report the problem and the nurse will do the assessment, and the full physical assessment will be done to exclude any possible organic problems up until a real mental health problem is identified. Of course, if it is a mild, problem that can be dealt with at primary level of care, the professionals at the primary level of care will deal with the problem. We're talking about a mental health nurse at primary health care.
Yeah.
We're talking about the psychiatrist. We're talking about the psychologist at that level and all the structures that are in place at that level. When there is an emergency, of course, the child then will be moved to an inpatient unit. Then that's when we start talking about either pediatrics or adult services.
And that's
for
the
complex
problem. Yeah, and I mean, sorry,
and that is the problem.
Yeah, your report is also sort of saying that at a primary level, primary healthcare is actually not bad at all for dealing with these cases. But when you talk about those facilities for 13-year-olds having to be housed with adults with similar problems, that is worrying. Obviously, during COVID, we've seen a lot more concerns. I just wonder, obviously this can be used countrywide. What is the most important thing that you want people to take out of this in terms of looking after our children? Because we know that children have lost loved ones to COVID, so a lot of our kids are grieving. They're quite fragile. If you had to sort of give me a summary of where kids are and what we need to be mindful of with our children's mental health, what would you say?
I do want to emphasize that everyone has to take cognizance of the fact that children, as much as some may not be able to express themselves or verbalize, instead they may act out, are definitely directly or indirectly affected by everything that is happening around them. As one of the findings also showed that there are so many external factors that contribute, to mental health problems for children. So from the parent to the teacher, to the neighbor next door, to the grassroots level service providers, to policy makers and everybody, we need to never forget that the child does experience emotional problems just like adults do. So we always need to be mindful of what they need and the emotional support that they need, especially during this time of COVID. As we all know, so many adults, we've lost them. We have not lost so much of the children, but those adults were caregivers of the children. And who are these kids left with? Where are they expressing themselves about what they are going through? So we need to open our eyes. We need to open our ears. We need to listen. We need to hear. We need to see. And then we need to reach out to them and identify the problem and be able to assist.
Such an important message and a really important body of work that you've put together. Congratulations and thank you so much for your time this evening. That is Dr. Stella Mokitimi. She's a PhD graduate from the University of Cape Town and she's looked at the psychiatric support for teens and children. She says there's problems at the top with leadership, decision making, and we have to start looking at separate facilities for teenagers who've got mental health problems and need to be admitted.